United States Senator Chuck Schumer was in Sidney this afternoon, Wednesday, November 23rd, at the Tri-Town Hospital, where he met with hospital administration and medical professionals to announce a federal rule change which will allow rural hospitals to maintain critical services.
So back in 2015, CMMS, which does all the, for you folks from the media, they do all the formulas, and their formulas can change and kill a hospital or hurt a hospital. Well, they issued a memo saying they were going to change how they defined a primary road to include single lane highways. Why a single lane highway is a primary road was beyond me. Now you say to yourself, what, who cares? But that's where the bureaucracy gets very complex and very frustrating. Because they were changing this definition, nearly a dozen rural upstate hospitals, including here in Delaware County, Margaretville Hospital and O'Connor Hospital, would no longer be classified as critical access hospitals for rural communities. It was infuriating, and the upstate New York hospitals were really scared because they depend on reimbursements they get from the feds to stay functioning. Because as I mentioned, it's harder for a rural, we want the best health care for people in rural communities as we do in urban communities, but it's more expensive on a per patient basis to provide that health care. Quite literally, because of tiny bureaucratic change, thousands of upstate New York rural families, many here in Delaware County, which was the place that was probably most affected, could have had their health care services just ripped away. The communities did not suddenly become less rural, and the roads didn't become major thoroughfares overnight. Delaware County would have lost $5.4 million that they receive from the feds annually. O'Connor would have lost $3 million, Margaretville $2.4 million. That's a lot of money for a hospital. What's O'Connor's budget?
It's about 16, 17 million.
So think of that, out of 16, 17 million, they lose 3 million. That's huge. That's the difference between a business staying open and a business going under. In total, $35 million in upstate New York would be lost for rural hospitals, from the Finger Lakes to the southern tier to the North Country. So Delaware County came in and talked to me. Our other rural upstate doctors let me know. So I got to work on this problem. It took a long time, dozens of letters. I even called the HHS secretary personally, because upstate New York's voices needed to be heard. And as majority leader and then as minority leader, I have more clout than the average senator, and I like to use it for New York, and particularly for upstate New York, which I've always done. So now I bring good news. The change was scrapped this month, and I'm supposed to hold up a newspaper and rip it up. Is this it?
Yes.
Here it is. This is their rule. Folks, you want to see what's happened to their rule?
There we go.
Okay.
We have a few more rules we'd like to.
Yeah. I enjoy ripping up these rules, so I have to change them. Okay. The change was scrapped this month. They promised me over the summer it would happen. After weeks of waiting, a little more pushing, it's finally happened. So Delaware County families and our upstate hospitals can breathe a sigh of relief. Their health care is no longer at risk of being defunded. Places like Margaretville Hospital, O'Connor Hospital will continue to get the millions from the feds they depend on to provide health services. So this is Thanksgiving, and what do we have to be thankful for? That this law that was going to just be devastating is no longer in effect. So that's the good news I have for everybody. And with that, we can turn it over to a little discussion on other healthcare issues or this issue that affect all of you. Okay?
Well, on behalf of the 9 of the 18 New York Critical Access Hospitals.
9 or Bassett?
No, total.
Oh,
only
right.
3.
Yeah.
Thank you so much. And it was a multi-year effort
Process,
to do it.
yeah.
And,
But I'm like a dog with a bone. I get a problem and we keep
yeah,
going
it was
after it.
wonderful. Thank you.
And it feels like that, why he said us is because we have this group
Same
in New York
thing.
State. Yeah, we
Yeah.
have a group in New York State of all the critical access hospitals, and we meet every couple months, and we work and fight as one group. And you know, it was such a happy time.
It was so ridiculous, and
Yeah.
no one really quite knows why did they do it to save money? I guess so, but it was stupid.
Mhm.
You know,
Single lane highways, for God's sakes, these are not big super highways.
every hospital in Delaware County is a critical access hospital,
Mhm.
and, you know, if something were to happen to the critical access program, it would devastate healthcare in Delaware
Yeah,
County.
you basically, you might not have hospitals. It's
Yes.
that devastating, it could be that devastating, yeah.
For sure.
So we can check that one.
Absolutely.
Check that out. One other thing I'll tell you, especially you doctors, who's a doctor, you will. So my uncle was the head of surgery at Strong Memorial Hospital. He was very famous. He was a surgeon. He was the head of the American College of Surgeons. His name was Cy Schwartz. And when you went to medical school, you bought that big yellow book,
Yep.
Schwartz on
Yeah.
Surgery.
Yeah.
That's his book.
Oh, that's crazy.
He did surgery on me,
Did he?
He did.
You up in Rochester?
up in Rochester.
Wow.
I got sent up to him
Wow.
many years ago. I had,
He's a
he
brilliant
did
guy.
liver surgery.
Yeah.
And the reason the book was a success is he's a Renaissance man, and he's a great artist. And evidently, to teach surgery, doing pictures doesn't work, drawings work, and he was a good drawer.
That's amazing.
Yeah, isn't that funny?
Absolutely.
Okay, want to talk about a few other issues? Who's gonna open up?
We do.
Well, I'll start, you know, things that affect us and other hospitals on the financial side of the Medicare sequester. That's scheduled to increase.
4.5%. This affects all the
Addition,
hospitals.
Yes.
We've gotten rid of it each time, and we
Yeah.
will fight to do it again. I'm
Oh.
optimistic we will get rid of it.
Great.
It's, you know, the one problem is here, we're trying to have a budget.
Yeah.
And we have a group, no offense to people on the Republican side, but we have a group of hard right Republicans, non-sewer type Republicans. And,
We
you know,
miss the moderate days.
yeah, they don't wanna do budgets, they want no money spent on anything.
Yeah.
And, they're pushing to do no budget, just do a CR, continuing resolution, which just echoes what happened last year. But even if it echoes what happened last year, you got the money last year, so I think we'll be all right.
Well, and I
But that's
think-
very important.
Yeah.
That's important to the biggest hospitals, the middle-sized hospitals, and the small rural hospitals, all of them.
I mean,
We collectively agreed before you got here.
Yeah,
yes.
Right.
That we would have two takeaway messages for you in
Go
that
ahead.
regard.
Great.
Because you are very aware. First of all, we celebrate you and we champion you for what you do to champion us.
Thank you.
It doesn't go unnoticed, and we're very.
Yeah, the one thing I ask here is, because people don't know, you know, but each of you, I don't know how many workers are there at your three hospitals?
Yeah, we have 600.
Yeah, send a little note to them, an email or what, that Chuck Schumer went to bat for us once again. Because I walk down the streets and people have no idea that I've helped.
You got it.
And that's probably more important to someone who works here than just about anything else.
Sure.
It's their job.
Yeah, we certainly appreciate you coming here. We appreciate the work you've done for us. We knew it was your birthday if you look over on the corner there, so
Oh, thank you.
happy birthday from all of us in Delaware, Shenango, Broome, and other counties around.
Yes, very nice.
You know, as Lisa was saying, you know, we have some broad topics that we know you understand, but really just want to hear it from us, and that is the financial situation of healthcare entities throughout
Terrible.
the state as well as throughout the country, and staffing. And if you combine the financial situation in general because of lower volumes, plus the cost of goods, plus the higher cost for salaries because our staffing situation, especially
Nurses'
for nursing,
salaries are very hard for you, right?
especially
That's
traveling nurses, but it is absolutely critical times for us. And I think one of the things that we wanted you to be aware of that we're concerned about is that it just doesn't seem to be out there in the media all that much, you know,
No, it's not.
the struggles of hospitals.
And I just wanna chime into that because, you know, not only does the shortages affect the big hospitals, it affects the small hospitals, it
Sure.
affects everybody, but
Yeah.
even when the big hospitals are short, it trickles down to us as smaller hospitals because we have no place to send our patients.
Yeah,
So we have a critical patient, we end up holding them in our ER sometimes for days,
because you can't send them to.
because there's no place to send because these guys
The
are.
other problem
Yeah.
is the big boys can pay more, and so if you need a nurse of a certain type, they can pay them much more money. Are you having trouble with nurses or not at the
Very
moment?
much so.
Horribly so.
Extraordinary
Yeah.
issue.
And is that because, did a lot of nurses post-COVID retire?
If you look, you know, I'm sure, if you look at healthcare as an industry, we lost 1 in 5 people over the past 2 to 3 years.
But
Nurses,
how much are coming back?
Not a lot,
Not
no.
Not much.
No.
Not a lot.
And some places are suffering from anywhere from 25 to 40% nursing
And were
vacancy.
they mainly older people or younger ones with children or across the
Well,
board?
a lot are staying with the agencies, even if the
Yeah.
rates are coming down a little bit.
And Senator,
Because
just,
that's an easier work
Yeah,
pattern.
more
Well,
flexible.
it's more flexible, it's more money, so that's one of the reasons we're losing so many people. If a nurse is making 3 times the salary, they decide to only work.
They go to visiting nurses and things like that.
They go to traveling nurses, and what they decide is, I'll only work 3 months a year. We now lost another 3/4 of a nurse.
Yep.
Because they're paying so much. So just something to keep in mind, you know, we're worried, really, could there be?
You gotta
some-
train more nurses, is the
Train more
It's a
nurses.
good, I mean, even a new nurse makes a good salary now, they never used to.
Yep.
Because women were not allowed to go to other things, so they became a nurse or a teacher, and the salaries were artificially low.
Mhm.
But now that those glass ceilings are broken,
Mhm.
you have to pay more, you know, to get a good nurse, this pre-COVID. And it's a damn good salary, and it's a, you know, it's a difficult profession, but it's a very fulfilling profession too.
And to tie into that, the LPN salaries are matching same rates you can get in retail and other industries. And so it's very hard to compete with those matching salaries across
Really,
industries.
retail is as high as a nursing, what's
For
it?
when you do an LPN salary compared to somebody working at a Target or a Walmart, you can make the same rate, and we are losing LPNs. If I had the hospitals, it's the RNs, the ambulatory, who are in our rural communities. We have one across the street right now where we provide primary care. It's LPNs is what we struggle with, and those LPNs are literally the same rate as somebody working in a retail space in a hospitality, but because of the pressures of COVID, working in that environment, people are coming out of healthcare because it's less stressful and the same amount of money.
So
and
what would the starting salary of a nurse be here?
So an LPN salaries, I would say starting salary with no experience would be roughly about $17 an hour,
Mhm.
18 at the most.
And
That's
RNs?
for an LPN. An RN, we're now up to approximately $30, $32 for a
You don't
base
pay a
salary.
yearly salary, you pay by the hour?
They are hourly.
So a related issue, and Lisa can talk about this eloquently, is the mandatory staffing in nursing homes,
Yeah.
which limits access to nursing home beds because of the staff.
The state
Backs
backs that.
up.
That's
And
Yeah,
the
that's
feds are
state.
about to do the same.
But it, you know, it's something that could be picked up. It's
Right.
in a few states.
Mhm.
Well, and the federal government is about, CMS is about to pass an overarching minimum
Right.
staffing mandate, full disclosure.
Wait.
I'm a nursing home administrator by birth. I've
But
been
where do
working-
they
I was 23.
Where do they think, where's the money gonna come from, and where's the people gonna
The
come from?
people.
That's
For-
our problem to figure.
You know,
out.
I champion the idea of adequate staffing. I can tell you, we always budgeted for more than the minimum staffing is requiring. It's
Right.
not about our
It's not
desire, it's physically about the people. And back to what Deanna's saying, nurses' aides, we lost them in droves with COVID, and people now, the negativity about the job makes us
Right,
hard to
because of
recruit them.
COVID.
Yes.
Yeah,
And they can go into retail, or if they can work at Dunkin' Donuts
And
and
make
literally
as much
make
money.
as much or more an hour.
Because
They ask you
Dunkin'
if you want
Donuts is gonna
cream.
pay $18 an hour
They
now.
are,
Mhm.
yep.
And they can push a 5 cent on.
Why did it go up so much? And why would it be the same? The skill of being a nurse is so much greater than the skill of being a Dunkin' Donut.
I think it's just because of supply and demand, they've had to raise their rates so much because there wasn't a lot of, people looking for jobs. And, you know, going back, echoing the healthcare issues is probably for the first time during COVID, those in healthcare realized, I can die at my job, you know, and I know 3 people that died personally that were good friends of mine, that were healthcare providers from COVID that they got while working. So, I
You know-
think that's really impacted it a lot.
And Dunkin' Donuts can raise the price of their coffee to pay for the increased salaries.
You've gotta
We can raise our
Yeah.
prices, but that's not what
Ain't gonna
we're
make a
getting
difference.
paid,
Yeah.
which is
And so-
where your help is greatly appreciated.
Right.
But the nursing home problem hurts the hospitals dramatically because
Yeah.
they can't decant.
Yes,
Yep.
right,
And it's
right.
really, the country, I don't know if you saw the Washington Post article from the weekend, it was very well done, and it had actually focused on Strong in Rochester, and it
mhm.
talked a lot about, you know, we're all now running suboptimal, Bassett used to be red bed status, I don't know if you
Yes,
know the term.
yes.
Red bed means we have, all of our beds are full and we have people in hall bed A and the
Right.
ER and hall bed B. Red bed now in our hospital is 76%
Yeah.
because we can't staff it. That's our
Staff
main
is not the
hospital.
pain, not the, so
Right.
where do all these people go who can't find a hospital bed who need it?
Hours and
We
hours
have
away.
patients at O'Connor and Little Falls who have been there upwards of 100 days.
Yep.
Not because they're difficult disposition. They may have mental issues, so nursing homes aren't gonna take them.
Yep.
They may not have insurance. There's not adequate home-based services. They may not have homes. And it's just absolute gridlock.
And the hoops we have to jump through to get
Right.
somebody into home care or
And
something
then
like
insurance
that.
companies will deny
Yep.
coverage too,
Sure.
which is another issue that.
And this is
needs
across the
addressing.
state problem, you can go to an emergency department and somebody needs to be admitted and there's no beds in that hospital, and they call every hospital in the state.
Yeah,
And you
I
show
know,
up
I
in
know.
Utica,
Yes.
you end up in Buffalo,
Yeah.
you don't know where
Yeah.
you're gonna end
Yeah,
up.
if
Or
we
they're
have to
ending up
transfer
out of
somebody,
state.
sometimes.
And you can't send
we'll
someone
call
to New
20
York
people.
City because of the pricing
Oh, no,
difference.
we'll do that.
No, we do, we have to.
Yeah, we go to Westchester, I haven't sent anybody directly into the city, but Westchester,
Yeah.
many
Imagine the
patients.
family
Right.
hardship though. right?
Terrible.
Yeah, one
When
person,
someone's sick, you wanna be there every day and
Right.
see
yeah,
them.
and 1 person in 10 in Delaware County does not have access to transportation. So imagine your family being.
Well, one of the
It's a
problems
national
is, look,
person.
healthcare has become more and more skilled. People live longer, it's not an accident. You tell people the story. When I was a little boy, I had a great-grandmother who was 82. And she was, and she was an old weazened lady. And she would come to our house, my grandma would bring her to our house, and she'd sit on a table in the kitchen. And all the kids in the neighborhood would ride their bicycles over and park them in front, go to the back of the house, and put their face against the kitchen window. Come to Schumer's house, he has the oldest lady in the world. Because no one was 82. And it's now, my dad just passed away, today's the annual, he died a year ago today. But he was 98, my mom's still 94. It's because there's much better health care. It's just more expensive. And most in society would pay more for it. Or at least have society pay more through Medicare, Medicaid, and these other things. But I'm gonna be a little political here, sorry. You've got these right-wing Republicans who just wanna totally cut health care. It's not like the old days when Nelson Rockefeller or Seward and people were around. And they're just completely cutting it, and yet the people in this county voted for them. So I don't know what kind of education job you need to do, but it's what someone like me is up against. I had 50 votes, I got very good votes for health care, but it was a struggle. And the average voter, the average citizen does not know the difference in this case, and health is probably the most important thing to every single person. I
Well,
don't know what you do about it, but
Yeah. We're happy we held the Senate, that is excellent, not the House. But we're certainly happy about that, and we just ask that anytime something comes up, you think about, reimbursement, training for,
Yeah.
for nurses, and really alternate methods
who
of
is
care.
your new congressman from here?
Molinar.
Mark.
Well, he's a very good guy. I got along with him great. He's a Republican. He was the head of Dutchess County. But you ought to bring him in here and tell him your needs.
Mhm.
He's not an ideologue. He's a fine guy.
Mhm.
And because if there can be a group of 30 or 40 Republicans in the House who say we've got to fund healthcare to the needs, they could join with Democrats and we could get this done.
Mhm.
And we used to have that.
Yeah.
This has been a production of The Reporter, Delaware County's leading news source.